Fellow, are you happy to kick off?
Yes, I'm all set.
Thanks very much.
Okay, thank you. Okay, good afternoon, ladies and gentlemen, and welcome to our fourth Young Professionals webinar. My name is Kolufelo, and I am a member of the Young Professionals Committee here at SAPEX. Before I introduce today's speakers, I'd like to remind everyone to please make sure that your microphone is muted so as to avoid any interruptions, and to please feel free to type any questions that you might have in our group chat. So the topic for today's webinar is supply chain management saves lives. What I'd like to say is that one of the silver linings, I would say, of the COVID pandemic is that not only did it highlight the important role that supply chain management plays in consumer markets, but also how indispensable a well-designed and managed supply chain can be when it comes to saving lives in the healthcare industry. And that's what our guest today will be talking about. So our guest speakers for today are Mr. Tapiwa Mukwashi and Mrs. Tiwonge Mkandawire from VillageReach, which is an organization with a mission to transform health and delivery to reach everyone in the healthcare industry. So just to give you a little background on our speakers, Mr. Tapiwa is a global supply chain expert with more than 15 years of private sector and international development experience across sub-Saharan Africa. He currently serves as supply chain director at VillageReach. Previously, he served as senior manager and program lead for the supply chain community for community health workers program. Tapiwa chooses to work for VillageReach because the organization has demonstrated a commitment to sharing the results of its work publicly, thus enabling it and others to learn both from its successes and failures. The mission to save lives and improve health by increasing access to quality health care resonates with his core values. And our second speaker, Mrs. Tiwonge. She is a senior supply chain manager with VillageReach. She works on last mile supply chain system strengthening with a focus on community health system strengthening. Tiwonge has over 10 years experience in healthcare supply chain and pharmaceutical strengthening and management in Africa. Her core areas of expertise include supply chain strategy and leadership development, supply chain workforce assessments and development, strategic partnership, and sustainable governance. Prior to joining VillageReach, Tiwonge spent 5 years with USAID South Africa as a supply chain specialist and later health system strengthening team leader from 2016 to 2021. In these roles, she provided strategic, technical, administrative, and financial directions for USAID's supply chain portfolio of 3 implementing partners with over $40 million. She led USAID's health system strengthening team in the President's Emergency Plan for AIDS Relief Interagency, as well as coordination with the South African National Department of Health, Global Fund, and other stakeholders. Without any further ado, I would like to welcome you both and thank you for taking the time to join us, and over to you. Thank you.
Thank you, Kolufelo, for the introductions. And I want to start off by saying this is an excellent initiative that SAPEX has started. And Kolufelo, thank you for demonstrating excellent leadership in growing the professional supply chain base in Africa. With SAPEX, you've got the right partner for your career development. Today, we want to talk to you about an initiative that we have been implementing along with other partners. And it's an initiative to deliver PPE to community health workers across a number of countries in Africa. Next slide. Our presentation is really much in 4 parts. We want to know each other. You know us now. We will tell you a little bit more about VillageReach, We will talk about CAF Africa, which is an acronym for COVID-19 Action Fund for Africa. And then we will close by talking about the opportunities that exist for careers in global health. We have been made to understand that the group that we are talking today is made up of students, new graduates, and some early career professionals. I have seen in the attendance list that we have some senior supply chain professionals as well, and that is quite exciting because it really demonstrates the cross-pollination of ideas that we seek to achieve with an event such as this one. So VillageReach is celebrating 20 years of existence this year. We've not stopped celebrating, and we will continue to celebrate right until the year closes. We started early on, and we have been known a lot to do work in the vaccine space in Mozambique. But what has changed is that our key thematic areas for our programming have expanded. We still do vaccines, but we do more than just vaccines. We have solutions to support supply and logistics at the last mile. We are involved in health workforce development, digital health technology, and data analytics. And the experience that we have acquired over the last 20 years informs how we do our work. You will see on the right of the screen, we demonstrate, we really want to put out to the audience just how we do our work as VillageReach. We believe no entity can replace government, and government is the institution with the right and the capacity to scale any intervention. So we put government at the front and center of our initiatives. We believe there are many partners, some in innovative space, some in academia, some in field implementation, and we believe in radical collaboration to build high, broad-based, trustworthy relationships to achieve impact. We also design what works now, but we design for the future. And we believe in building on what works. We have our supply chain technical expertise based in sub-Saharan Africa, and we want to demonstrate to the world that it is really possible to develop high-quality supply chain technical assistance in Africa, putting an end to an era where we would have fly-in, fly-out consultants coming from other parts of the globe. So this opportunity to talk to young professionals in SAPICS dovetails with our vision to developing and creating high-quality supply chain expertise. Now, to talk about the COVID-19 Action Fund for Africa. In short, CAF Africa. So when you hear me talk about CAF Africa, I'm just putting in short for our COVID-19 Action Fund for Africa, which is an action-oriented collaborative of plus 30 organizations that are dedicated to protecting community health workers at the front line to protect Africa from the COVID-19 pandemic. I will assume here that we are all familiar with community health workers. If you are not community health workers, these are lay people trained in the communities to provide health services within the communities they serve. They are not trained to be to the same skill level as nurses, but they do create an enabling environment for some conditions to be treated at the community level. In countries such as Liberia, 30% of the population receive health services through community health workers. So applying a bottom of the pyramid approach, you can be rest assured community health workers enable the health systems to access the bottom of the pyramid. Key statistics that have been coming from the WHO have shown just how an increasing rate has been experienced of community health workers being infected with COVID, and how that infection rate has been curtailed, has been stopped with the use of PPE, with community health workers accessing PPE. And so this initiative has really looked at this statistic and says it is important for community health workers to be protected, because with or without COVID, they are going to be providing services to the communities. They're going to be providing routine services for malaria, for diarrheal infections, for malnutrition. And if they are going to be providing these routine services, they are going to be in contact with members of the community, which elevates the need for them to have personal protective equipment to make them safe and to make sure that the clients they serve are safe. Our initiative is based on evidence. So a research that was conducted by the Center for Global Development outlined that for community health workers in Africa, close to 500,000, 1 million community health workers would need 450 million pieces of PPE per year. This is PPE, talking about surgical masks, gloves, eye protection in the form of face shields, gowns. They also need disposable bags because there's a lot of waste management that is created by the use of face masks and all the equipment that they are using. And this research really informed what we set out to do. And we set out to equip 1 million community health workers with the PPE that they need to be able to provide routine and emergency services over a period of 1 year. So given the challenge, the community health workers need PPE, they need to be protected. How are we going to go about it? We turned to one of the key principles of VillageReach, that we will need a radical collaboration at an extent that has never been seen before in the space that we work. Who are the partners that we set out to work with? We developed relationships with governments across 18 countries. Developing formal documented relationships means getting MOUs with them and understanding their priorities as individual governments, but also as part of a group. We also turned to members of the Community Health Impact Coalition, a grouping of over 30 organizations that are already working with the governments in these 18 countries. Our principle was we want to work with government, but we want to provide government with the capacity to act with speed and to be able to access resources that governments were not able to access during the COVID-19 pandemic. Because it's a large group, 18 governments, 30 organizations, we needed a structure that would allow us to work and deliver on the goals. And this is what saw us turn to the organizations and the competencies that they possess. So VillageReach became the technical lead for the supply planning for the whole initiative, with Direct Relief that was responsible for all the procurement, global procurement that was being conducted. Panorama, there's a lot of communication messaging that is involved in working across 18 countries. Panorama provided the expertise for that. We also had CHAP that was providing leadership and financial support to this initiative. On the right, I have put a diagram that really demonstrates to you that although we had to apply our supply chain and logistic knowledge in this space, the interface with other programming factors is very important. The fund is going to be managed with accountability. The fund is going to be managed ensuring that the key principles for providing aid support to governments on a no harm basis are adhered to. We had to be conscious that there is many ways that communications can be formatted and that this is to be aligned. So all this created some back office staff, supply chain and logistics that was done independently, and some front office activities that involved interactions with a lot of other key stakeholders. And because we needed an approach, if we are working with 18 countries, we need a standard approach of engagement. What we do with country A is what we do with country B. And we did not want to duplicate the efforts of other organizations in country. We knew UNICEF was in the country procuring and supplying PPE. The same goes for the Global Fund. there are a lot of other organizations that were also providing support, and we were focused on making sure that we fill the gap, not to duplicate. And so how did we fill the gap? We set out a process, a gap identification process. We developed tools that are reusable, that can be found on the CAF Africa website, which you will get at the end of this call. And these tools allowed us to quantify the specific need for community health workers, since they were mostly being missed in procurements that were being conducted by government. We said, even though we are responding to an emergency now, we're to think that there's going to be a life after an emergency, and we want community health workers to be continuously provided with personal protective equipment post the emergency period. And so we also took a system development lens to the activities that we were conducting. Many community health organizations are typically small, passionate organizations working in a district or some particular provinces, and at best they're only able to make certain small procurements. And we said we want to use this initiative to make sure that we have a massive pooled procurement mechanism that allows actors in the community health space to pool their procurement, to experience price competitiveness, to be able to negotiate prioritization in terms of getting supplies earlier. You will see later in a later slide that even with this pooling, even with this desire to have material supplied earlier than the other procurement entities, we still face challenges, but we've been able to do a lot. So how much PPE do community health workers need? We're looking to supply 443 million pieces of PPE to make community health workers provide services to over 400 million people. And we keep hammering these numbers because they are important for us to be able to measure our impact. So in our solution, we divided our supply chain into three phases. We had the first mile, the middle mile, and the last mile. The first mile was being handled by direct relief. They were responsible for negotiating with the manufacturing companies, making all the necessary arrangements for ocean or air booking. We had the privilege of benefiting from WFP, who provided the initiative with a free-to-use global logistics services that saw us carry the equivalent of 7 jumbo jets. This is massive volumes we're talking about, for free to the over 18 countries that were involved. As the supply chain team, we made sure that all this was being tracked. There was quality assurance, inspection and certification done, regardless of where the items were procured from. Some items were coming from Malaysia, some were coming from Indonesia, with lots of supplies from China. We had some PPE coming from the United States, and regardless of where this was coming from, the quality certification was paramount. At the middle mile, we had to mix and a model mix of the modes of transport we're using. We used air, we also used ocean transport because we just had to make sure that all the challenges that were being experienced with difficult bookings and cargo space, to find ways through which we could address these. Tiwonge will talk about what we did on the last mile, breaking bulk, repackaging into smaller units, because the loads get smaller and smaller. They are mountains when they come at the airport, but they are motorbike type deliveries when they are made to the community health worker at the point that they are delivering the service. And we talk about products to people because we are passionate about transforming the paradigm where community health workers have to move 20 to 30 kilometers to the nearest health facility to collect medicines or PPE. And we believe this must be transitioned, and PPE must always be delivered right to their doorstep, increasing their convenience, increasing the ease with which they're able to serve their community. it's been a long road. This chart tells you just how long it took to process orders. At the max, which is at the bottom there, and this would certainly be Angola. From the time the government indicated they wanted PPE to the documents, to the actual PPE arriving at the airport, it took 148 days. This is close to half a year. 37 days with the government justifying the quantities they need and demonstrating that in the warehouses, the other organizations have procured so much. 21 days before we get the green light to ship. So once you have staged the items internationally, you just don't put them on the nearest ship or plane. The government has got to confirm that we're ready to receive. This meets the quality standards that we use in country. And so this explains that on average, it was an 87-day cycle from us engaging the government to until the items arrived at the airport, and 148 days on the max. I will not talk about how long it took in some countries for the items to be cleared from the airports, from the airport to the central medical store, because that was another layer of delays as well. The next slide shows some of the bottlenecks that were experienced. Initially, there were challenges with sourcing, orders cancelled, orders postponed, and I'm sure that many on this call would have experienced the same challenges as well. And once the items arrived at the central medical stores, there was a lot of bureaucracy. It took a long time for the government to develop the distribution list. Secondly, the government changed the priorities. Once the items are in store, even though they knew the priority was community health workers, they reprioritized the PPE quite understandably to save other healthcare workers that possibly are in higher tertiary facilities. It's acceptable as long as the PPE is being used for guarding and protecting against COVID. But we were very conscious that we have to keep motivating the government to see a flow through of some of the PPE going to community health workers. And I'm glad to say close to 65% of the PPE reached the target, although there were diversions there. Next slide.
Thanks, Tapiwa, for taking us through that. I think I get the easier side of things. Tapiwa explained some of the hurdles that we've had to go through to be able to get to the point where we can celebrate the fact that in a period of a little over 9 months, we've been able to secure commitment and procure roughly 81 million pieces of PPE, the bulk of which were masks and gloves, because the community healthcare workers that we're targeting spend a lot of time talking to people face to face and touching mothers and children in certain cases in order to be able to diagnose. So those items were critical. So in that period, we've touched nearly 500,000 community healthcare workers in the 18 countries that are shown on the right. The work is still ongoing. We are in the process of preparing our next few shipments that are worth roughly 20 million masks, I think, if we get the price right, and we're hoping to have those delivered by the end of next month, if all goes well. So the point is, despite all of the challenges, there has been significant progress, which we believe is touching lives. Tapiwa mentioned earlier about how, as VillageReach, we are very passionate about the last mile. Before you all logged in earlier, we were joking about how VillageReach is really a whole lot of people. We are a village, we're a family, and we focus on making sure that the people and families that are living in places that are very hard to reach sometimes, far away from the nearest clinics, we want to make sure that those people are getting access to the necessary care that they need. So by providing the PPE and making sure that it travels this last mile where the community healthcare workers or their supervisors and other staff in in the country would be responsible for collecting PPE that would have been delivered at a clinic or some other pickup point that's closest to them, that they then travel that last normally 5 to 20 kilometers to the homes of the mothers and children that need the services the most. So on this slide, you will see the motorbikes, the gentleman walking with the staff in the middle, and someone in a canoe trying to make sure that they get that PPE to that last mile. So I'm going to share just a few of the lessons that we have learned and factors that we believe are important for people to keep in mind when they are considering doing work in this space, and for you specifically as you think about, for those that are early in the careers, if you are considering careers in this space, just to be aware of, you know, what life is really like in that last mile. One of the first things that Tapiwa mentioned is we believe in working with the government and making sure that the government remains at the forefront of all of the efforts that we do, because at the end of the day, they will be responsible for keeping the work going. They are the ones that are accountable at the end to the people. On the other hand, though, generally in most of the countries that we were focusing on, there is a lot of infrastructure that the government already has in place. In this picture, you will see that in most cases, the PPE that we sent was stored in government-owned warehouses. There were a few instances where the volumes were too bulky and just were in excess of the capacity that was available in the warehouses, in which cases we collaborated with organizations like UNICEF and others to use their spare capacity, but predominantly the government warehousing, government trucks were being used to store the product and move it to district warehouses and health facilities where the PPE was actually collected. So making sure that we're working with them, leveraging their expertise and infrastructure is critical to being successful. The reality about some of the countries we work in is some places are really hard to get to. You'll see the picture on the top there. That is in a picture of community healthcare workers arriving on what is called Dilolo Island in the Democratic Republic of Congo, DRC. The only way to get there is by canoe. So we had to make sure that we work with the local government as well as local partners to be able to use the canoes that were already going there to deliver PPE where it's needed. On the other hand, we were fortunate in one province in the DRC, the Equator province, that as VillageReach, we are in the process of piloting a Drones for Health program. If you get on YouTube, you can see some of the information about how that work is going. But we were able to leverage that to be able to send some of the lighter items to about 12 health facilities that would have been unable to get any PPE otherwise. Another key thing that was critical to us being able to achieve the magnitude of deliveries that we were is leveraging the expertise and the infrastructure and resources of other local partners. Tapiwa mentioned the Community Health Impact Coalition, acronym CHWs, which has got more than 30 organizations. One of those organizations is Last Mile Health, which we work with quite closely in Liberia. And as you can see in this picture, we were able to use their transport to collect and distribute PPE from the counties. So here in South Africa, we talk about districts and sub-districts. In Liberia, the lower level of the government is at the county level. So they were the ones that were helping us move PPE from the county depots or warehouses to the health facilities where the community healthcare workers would then be able to access, which is something we would not have been able to do with the investment that we had. And then this is something that is not going to be a surprise to anyone on this call. One of the things that we made sure we do is being able to keep track of the key performance measures for the different stages of the distribution. So taking a look at how much had been received at the warehouses, how much had been distributed to the county level, how much had ultimately made it to the last mile collection point, and most importantly, how much of that was eventually distributed to the healthcare workers that needed this PPE the most. In order to be able to measure that, we had to rely quite heavily on existing supply chain information systems that were on the ground and leverage the relationships that enabled us access to the data out of those systems. But at the end of the day, if you look at the gentleman's smile on the left, that is a healthcare, someone from a healthcare center in Malawi, being able to issue PPE to others in the health facility with a big smile. This ultimately is what we are working towards, to make sure that the people that are in the front lines, in the places that are hardest to reach, are still able to get the PPE of the right quality that they need to be able to serve the 400 men, women, and children that we're targeting in this continent. So Tapiwa said a little bit about how we will end off with just sharing some thoughts with you as, if you're considering careers in this space. As supply chain professionals, the world is pretty much your oyster. You can go into private sector, public sector. However, if you do consider working in the humanitarian and development space, we thought we'd share some of these realities, first of all, about what it takes. You need to be prepared to work with people. You'll be interacting with suppliers, both local and global. You'll be working with different parts of government departments, every line from the ministries of health to treasury, corporate governance, and other sectors. You'll be working with implementing partners such as ourselves and other organizations. You might be interacting with donors, and that take the form of governments, international organizations, or agencies like the UN, as well as some independent philanthropists that are looking to make a difference. You need to be prepared for some hard knocks. That picture you see on the right is real. It's a bridge in Liberia. This was taken by one of our team members as they were on their way to go and deliver our products to one facility that's hard to reach. That is the reality of some of the places that you would need to be able to work. And one needs to be prepared to bounce back and find solutions on how to still get product to where it's needed. One of the things that we learned in this process is sometimes it, especially in an emergency setting, sometimes it costs more to be able to get the product to where it's needed, which is a bit of a shift from what we tend to aim for as supply chain management professionals, which is get the product where it's needed at the lowest cost possible. But if you've got people that cannot save lives if they don't have PPE, sometimes paying for that air freight is necessary and a much more realistic choice, even if it costs more than putting the product on the sea to get to the country a little bit later. So aside from those realities and some of the tougher stuff, at the end of the day, what we believe is, we would be very grateful to have more dynamic and, really skilled professionals working in this space, because, the work that gets done can make a difference in real people's lives out there. And so with that note, just letting you know that there's a big gap in the supply chain space, especially in the humanitarian and development space. There's a lot of demand for local expertise. A lot of donors and governments are really keen to have people from the countries where this work is being done actually providing the professional services there. There's even more demand in the Francophone countries, so the French-speaking countries like the DRC, Cote d'Ivoire, Mali, where their professionalization of the supply chain is still very much in the early stages, and the demand for for service delivery is great. So if you can speak French, keep that in mind, or if it's still early, it's never too late to learn a new language. Maybe French is a good idea. And then last but not least, there's a lot of emphasis on professionals and solutions that are data-driven. And I think that's something that I don't need to say too much on, because it's a trend that we believe is there across not just this sector, but all of them. So with that, I'd like to thank you and take any questions that you may have.
Thank you very much to both of you for that very enlightening and humbling and thought-provoking presentation. The work you do is just phenomenal. I just wanted to kick off quickly with a question. I will check in the chats, but anyone who has any questions, please feel free to raise your hand and we can start the discussion. Just wondering, the 18 African countries that you've identified, how did you identify them? Was it hard to sort of make those decisions? And are you planning to move into other African countries?
Hard, no. So we were also taking opportunity. First was because there was a publication supporting where the need was highest. We turned to that to look at the incidence rate, which countries were most affected, which countries had a bigger gap. We also looked for countries that had a community health worker policy. So if there's a policy in place, it's easier to identify who the target is. And although in some cases they don't have the community health worker register, but they do have projects working in the country.
Okay.
And so we also said it would be a big advantage if the country had a member from the Community Health Impact Coalition that would provide an easier channel through which the products would flow.
Okay, yeah, that makes sense.
I also saw in the chart, there is this question about why do we have to continue procuring from China or from Malaysia? Why can't we drive local production? And so the discussion for local production is very important, because what we know is that for our health systems to be resilient, we've got to have local manufacturing capacity that is able to provide PPE in short notice, that will be able to prioritize local orders as well. But there's always a time lag between building the capacity and when the PPE is needed. Some of our biggest frustrations were giving suppliers in Africa, I will not mention which countries, very big orders, and them being unable to deliver. And so building that resilience is definitely a big step that we are working with. There are conversations led by the Global Fund, by the Gates Foundation, by the IFC, to identify the ways in which we should build the capacity. Should it be local or country level? Should it be regional? How do we facilitate the technology transfer? There are quality considerations. If they can manufacture it, is it going to be certified Europe? Is it going to be FDA approved? There are a lot of considerations that go along with developing local capacity, but that is the vision, and that is certainly where we want to get to. By the time we get to the next emergency, there must be a bigger capacity to supply PPE and medicines from within the continent.
Brilliant. Thank you for that answer. Kolofelo has a question.
Thank you, Claire. Okay, so my question is, one of the challenges that the pharmaceutical and health industry is facing is safeguarding their supply chains against counterfeit products. And a great example is like countries like Kenya. They have started like incorporating technologies such as blockchain into their health care supply chains in order to ensure the quality of the product by transparently tracking the product as it moves throughout the supply chain. So I guess my question is, has VillageReach experienced any supply chain challenges in this area, and what innovative solutions are you guys putting in place? Thank you.
Thanks, Kolofelo. That's a brilliant question. I will preface and say one of the biggest challenges is that every time there's a spike in demand, there's an opportunity for people to cheat their way to the wealth. And so that includes manufacturing substandard products. And so blockchain presents a real good opportunity for the future and for the present. In some industry, it's being used extensively in the private sector. And we are right at the interface of making sure that we facilitate its transition to the use in the public health space, which usually focuses on, we want technologies when they are cheaper and more affordable. But quality is important. And how have we sought to maintain the quality? We've gone traditional, not innovative. And that says we procure from WHO pre-qualified suppliers. And that says we get pre-delivery inspections by certified quality assurance organizations that give us quality certificates. And these are very important since the countries will need them. But I do agree that blockchain technology will be important. There will have to be investments made in the countries. There will be investments made with tier 1 and tier 2 suppliers. And this is the future that we are all hoping to get to, in which we have much transparency and better end-to-end visibility, which does not exist presently.
Thank you,
Kolofelo, for that excellent question. We just have a comment here from Simba, who says the current pandemic has shown how important it is for local manufacturing in Africa, and countries need to take lessons to prepare for future pandemics. I think that's a good comment.
An excellent comment. It reinforces the need to be resilient. And when we think resilience, we are saying if the emergency comes, can we resist, the catastrophe? Even if we can't resist it, can we get up again and do what we need to do? And so building some of those resiliency mechanisms, creating a resiliency framework. And on the resiliency framework, the supply says we've got to have a good mix of international procurements, local procurements, international supply, local supply. American companies, everyone was looking east to China, and we know now that that isn't the most strategic thing to do. You've got to produce local sometimes and have a good balance of local availability and price competitiveness. In the private sector, we know now that there is multi-objective system design. Previously, system design was just focused on achieving a single objective, that is cost minimization. Now we need more than cost minimization. We need a system design that focuses on equity, that focuses on resilience, that is efficient on cost as well. So having that capability to do a multi-objective system design is very helpful to, encouraging people that always look at the bottom line, why it is important to manufacture locally.
Jenny has a question about drones, but also just agreeing with you on saying make sure you don't have all your eggs in one basket, and that in itself creates some opportunity in Africa, which I often think that we know is there, but it's quite hard to kind of action. And it would be great if people, manufacturers, could step up and be there and be available, and so that, as you say, the product is close and on the ground. Jenny's question is, are drones really practical for the last mile distribution?
We get that question a lot. Tiwonge, let me try. You know, when the Wright brothers started trying out to fly, everybody looked at them and said, oh, these guys are crazy, right? And now we are flying jumbo jets. And so some of the questions that get asked a lot are drones practical? And I will answer it in two parts. Has it been demonstrated practically that a drone can have a takeoff station and a landing station and take off with either vaccines or PPE? That has been demonstrated. We are having more than 300 flights in the DRC. We're having flights in Malawi. There's a lot of regulatory space. It's very controlled space by the military. And so a lot of negotiations you have to go in terms of creating a pathway for the legal flights to take place. But practically, drones are being manufactured that can take off without a runway, that can take off in the same place, that have a wider wingspan, that can carry heavier loads. Is it cost efficient? And that is some of the evidence that is being generated by the current drone applications that we are seeing across a number of countries. But in an emergency, we always work on a no regrets basis, even if it means we're going to spend $1 million to access that place. If it means saving lives, we don't regret any of the costs that will be spent doing that. So is it going to be efficient for routine use? The evidence is coming. Is it justifiable in an emergency? We don't regret any of the costs that are used. So yes, it's really practical in the current landscape to use drones.
Sorry, can I just add something in there? So I'm a big public health person, you know, bleeding heart type of thing. But I think one of the things that is critical for me when we're talking drones in this space is thinking through how we value life, right? Because there's certain places where being able to get to a mother or a woman who is in labor and needs that oxytocin so that things can go well, it may depend on us being able to put that vial on a drone so that it can get to her within the hour that she needs it to be, otherwise she dies. So those are some of the tough decisions that need to be made. I've put a video in the chat on YouTube that tells you a little bit about the Drones for Health work in the Equator. And I don't remember the exact figures, but in this particular instance, there are about 12 odd health facilities where normally it would take someone pretty much a day or two to be able to travel from the clinic, to travel 45 kilometers, and it's not like it's very far, to get to a central place, to pick up vaccines and other things, and if they're lucky, be able to get back the next day or maybe 2 days later. And this person is normally the very same nurse who is supposed to be serving people in that clinic. So then that's where the question comes in. Is it worth investing in drones for certain very targeted aspects of the supply chain so that we can meet the critical need in places where it's nearly impossible to get product, and then counter that by getting savings somewhere else in the system? So it's one of those things that it's a question that still needs to be answered, I think, as we generate the evidence. But as we do that, like we said before, at the center of all of this, it's the people. So how much is a life worth? And in that case, if we can save a life with the drone, should we spend that money?
Thank you for that, and for the YouTube link, which we'll circulate with the presentation as well. If anybody's interested in pursuing a career in this wonderful industry, how do you suggest that they sort of go to the next step? I know it's a very big question, but perhaps just with VillageReach as well, what would sort of be the next step in terms of seeing what's available in terms of jobs in particular countries and whether their qualifications match that? Is there a contact or?
Sure, maybe I can
yes.
Take a first crack at that, and then Tapiwa can share a bit. there's a lot of information that's out there in this space. I think the point is to know what to look for and start getting familiar with the types of organizations that are involved. What I would recommend is, one, obviously linking up with professional associations like SAPIX, but then just being aware of some of the other places like DevEx. I'm going to put the link in the chat. And I see, thank you, Jenny, you've put in there the information on IAPHL, which is an International Association of Public Health Logisticians. So there are, if you go to websites like DevEx, go to the VillageReach website, which is on the slide deck that you will receive, as well as the Direct Relief website that you'll receive. Chic is another one. We made reference to it in our presentation. Go to their website. You will start getting exposed to information about a lot of the implementing partner organizations, in which case you can follow them on social media so that you can get up-to-date information on what they're doing, but also the opportunities that they have. Another option is to also follow some of the big guns, the United Nations, UNICEF, World Food Program, USAID, the Centers for Disease Control. There are all these organizations out there, and you can get a lot of information on that. And Tapiwa, thanks. You've also just shared the Relief website, which has got a lot of information as well. So this is a starting point.
And I just want to butt in there very quickly. One of the things that really astounded me, and thank you to the two of you, but one of the things that when I first got involved in the public health humanitarian aid space was how many diverse training you can do to get into it. It's a bit like supply chain management. A lot of people fall into it, but nutrition, food and nutrition is one area that you can study in order to be able to work in this field. And that had never really hit me. But if you think about it, it's logical. You need to educate people who don't have access to normal education, and also for alternatives in times of drought and all that sort of thing. So think outside of the box too, if you're interested in getting into this area of the supply chain, or this area of work.
Jenny, it's interesting that you mentioned nutrition, because nutrition logistics is very important. One of the biggest conditions that affects us is malnutrition in Africa. You can go on the web, just Google malnutrition in Maiduguri in Nigeria, malnutrition in Somalia. And to combat malnutrition, there is the use of ready-to-use therapeutic feeding, RUTF in short, and it's imported and manufactured in huge quantities. And sometimes when you see how much of it is lost in West because of rats as big as people, rats, very big ones, due to poor storage conditions, low accountability. There's a whole big logistic and supply chain enterprise around nutrition supply chain. You've got to know it. There is malaria logistics, the volume of malaria medicines, the quantum of mosquito nets that have to be stored and distributed, and distribution strategies defined. Community health workers now treat for diarrhea. There is ORS. It will be important for you, if you want to go into public health logistics, to acquaint yourself with some key terms. Go onto the WHO website, look for some free courses. You must be able to talk confidently, even though you are not a pharmacist, about essential medicines list. You must know standard treatment guidelines and how they are used. You must know about donation guidelines and how they are applied across some countries. It helps you transform the knowledge that you have, the scientific supply chain knowledge that you have, into context-specific knowledge where supply chain must be applied within a certain space with rules, regulations, and principles that you need to understand. I like that SAPICS has been talking about professionalization, because it is going to provide the kind of standards of knowledge, standards of competence that a person must pursue before they, they can be certified to be able to do certain type of tasks. But it all comes down to storekeeping units. If you have learned supply chain either in an engineering department, in a business unit at the university, it all comes down to storekeeping units. So whether the storekeeping units are beer, Coca-Cola, tablets, mosquito nets, nutrition items, they are storekeeping units. You will need to do one or two things to understand the storekeeping unit, its characteristics, its handling requirements. Nobody knew about the COVID vaccine, nobody learned it in university, but everyone that has taken the steps to learn about the COVID vaccine, we now have COVID logistics experts now. They've customized the knowledge around their primary training and the new product that's being developed. As VillageReach, we value a lot developing talent, skills. Although we have limited capacity, we approach universities, we take students on attachment, preferably 6 months to 1 year attachment, not like the 1 month attachment. I will be talking to Jenny, and we will be possibly extending this opportunity to take some SAPICS members. They do the selection, so we don't get to interface with all the students that are looking to work with VillageReach, and hopefully encourage some students that through SAPICS, you will have an opportunity to meet your future employer. Thanks, Jenny.
That sounds amazing. Thank you for that initiative and suggestion. Are there any other questions, or can we close? Or any other comments? Thank you both for that heartwarming presentation, and very interesting, and kudos to you for the amazing work that you've done. 81 million is a lot of PPE equipment. The last mile philosophy is incredibly inspiring, and I think it's something we should be applying to all aspects of our lives. So thank you to you both, and good luck with your work and in the future, and happy from a SAPICS point of view to assist you wherever we can. And thanks everybody for joining us on this Winter's Day if you're in Johannesburg. And just a reminder that our 43rd conference will be taking place next month, 24th to the 26th of August. And we look forward to your participation. Please register and be part of more conversations like this. And thank you, Mike, for registering already. And yeah, be part of these amazing conversations and discussions about supply chain in Africa. And I look forward to seeing you all there. So take care, everyone. Look after yourselves, be safe, and thank you again to the VillageReach team for being with us today. All the best.